CEN written exams in the world. Question 1. Which of the following is the most effective approach for de-escalating an agitated patient? Option A. Use a firm, loud voice to establish authority. Option B. Maintain a calm, non-threatening tone and provide personal space. Option C. Immediately call security for assistance. Option D. Restrain the patient. The correct answer is option B. Maintain a calm, non-threatening tone and provide personal space. De-escalation is a key skill for emergency nurses. It involves using a calm, non-threatening tone, maintaining personal space, acknowledging the patient's feelings, and allowing them to express themselves. Firm, loud voices can escalate agitation. Security may be needed if de-escalation fails, but it should not be the first approach. Restraints are a last resort. Question 2. A patient is 32 weeks pregnant and presents with vaginal bleeding, abdominal pain, and contractions. The CEN should suspect. Option A. Placenta previa. Option B. Abruptio placentae. Option C. Ectopic pregnancy. Option D. Normal labor. The correct answer is option B. Abruptio placentae. Abruptio placentae, placental abruption, is the premature separation of the placenta from the uterine wall. It presents with vaginal bleeding, abdominal pain, uterine contractions, and fetal distress. Placenta previa is painless bleeding, ectopic pregnancy is early gestation, normal labor is at term. Abruption is an obstetrical emergency requiring immediate delivery. Management includes 4 fluids, blood products, and urgent delivery. Question 3. A patient with a history of COPD is being discharged. The CEN should provide education on Option A. Smoking cessation. Option B. Use of bronchodilators. Option C. The importance of pulmonary rehab. Option D. All of the above. The correct answer is option D. All of the above. Patient education is a key part of CEN practice. COPD discharge teaching includes smoking cessation, correct use of bronchodilators, pulmonary rehabilitation, and monitoring for signs of infection. This is part of professional nursing responsibility. Question 4. A patient with suspected measles should be placed on which type of precautions? Option A. Airborne precautions. Option B. Droplet precautions. Option C. Contact precautions. Option D. Standard precautions. The correct answer is option A. Airborne precautions. Measles is highly contagious and transmitted via airborne particles. Patients with suspected measles should be placed on airborne precautions in an AIIR with negative pressure. Staff should wear an N95 respirator. Droplet precautions are for influenza, pertussis, and meningitis. Contact precautions are for MRSA, VRE, and C. diff. Measles requires airborne isolation. Question 5. Which law requires screening and stabilization of patients in the ED, regardless of ability to pay? Option A. HIPAA. Option B. EMTALA. Option C. OSHA. Option D. ACA. The correct answer is option B. EMTALA. The Emergency Medical Treatment and Labor Act, EMTALA, requires that anyone coming to an ED must be screened and stabilized, regardless of their ability to pay. This applies to all hospitals that participate in Medicare. Patients cannot be transferred without being stabilized, unless medically indicated. EMTALA ensures access to emergency care for all. Question 6. A patient with an amputation of the finger is brought to the ED. The amputated part should be Option A. Placed directly on ice. Option B. Wrapped in moist gauze and placed in a sealed bag, then on ice. Option C. Placed in a dry bag. Option D. Discarded. The correct answer is option B. Wrapped in moist gauze and placed in a sealed bag, then on ice. The amputated part should be wrapped in moist gauze, placed in a sealed plastic bag, or container, and then placed on ice, not directly on the ice. This preserves the tissue for potential reimplantation while preventing thermal injury from direct ice contact. The CEN should ensure rapid transport with the patient and the amputated part. Question 7. A patient with a suspected globe rupture should: Option A. Have the eye patched and the patient placed NPO. Option B. Have the eye examined with a slit lamp. Option C. Be given 4 antibiotics. Option D. Be discharged with a follow-up. The correct answer is option A. Have the eye patched and the patient placed NPO. Globe rupture is a surgical emergency. The eye should be patched with a shield, not pressure, to prevent further injury. The patient should be NPO for possible surgery. Ophthalmology consult is needed. Slit lamp examination should be done cautiously if a rupture is suspected. Antibiotics may be given prophylactically. Discharge is contraindicated. Question 8. A patient presents with suicidal ideation and a specific plan to overdose on pills. The CEN should: Option A. Ask the patient to sign a no-harm contract. Option B. Place the patient on a 1:1 observation and initiate a psychiatric hold. Option C. Discharge the patient home with a safety plan. Option D. Administer a benzodiazepine to calm the patient. The correct answer is option B. Place the patient on a 1:1 observation and initiate a psychiatric hold. Patients with suicidal ideation with a specific plan require 1:1 observation, suicide precautions, and a legal psychiatric hold, 5150, Baker Act, etc. A no-harm contract is not sufficient and may provide a false sense of safety. Discharge is contraindicated. Benzodiazepines may be used for agitation but are not the primary intervention. The CEN should remove all potential self-harm items, sharp objects, belts, etc., and ensure constant observation. Question 9. A patient with a suspected overdose of opioids has a respiratory rate of 6 breaths/min. The CEN should: Option A. Administer naloxone 0.4 mg 4. Option B. Administer naloxone 2 mg 4. Option C. Administer naloxone 0.4 mg IM. Option D. Administer a naloxone drip. The correct answer is option A. Administer naloxone 0.4 mg 4. Naloxone is the opioid antagonist used to reverse respiratory depression in opioid overdose. The standard initial dose is 0.4 mg 4. If there is no response, the dose may be repeated. Naloxone can be given IM or intranasally if 4-access is not available. The CEN should start at 0.4 mg 4 to avoid precipitating severe withdrawal in opioid-dependent patients. Question 10. A patient with mania is disruptive and not responding to verbal redirection. The patient is placed in 4-point restraints. The CEN should monitor the patient every: Option A. 30 minutes for circulation, nutrition, elimination, and mental status. Option B. 60 minutes. Option C. 15 minutes. Option D. As needed. The correct answer is option C. 15 minutes. Restrained patients require frequent monitoring to ensure safety. In ED settings, restrained patients should be monitored every 15 minutes for circulation, respirations, nutrition, elimination, and mental status. Restraints should be used only for patient or staff safety when less restrictive measures have failed. Restraint orders require a physician's order and are time-limited. Question 11. A patient with acute stroke has aphasia. The CEN should: Option A. Speak loudly and slowly. Option B. Use simple, short sentences and allow time for response. Option C. Avoid speaking to prevent frustration. Option D. Write everything down. The correct answer is option B. Use simple, short sentences and allow time for response. Aphasia, language impairment, often expressive or receptive, in stroke patients requires patience and clear, simple communication. Speaking slowly and using short sentences reduces cognitive load. Speaking loudly is not helpful as aphasia is not a hearing problem. Avoidance limits communication. Writing may help some patients but should be combined with verbal cues. Speech therapy consultation is appropriate. Question 12. A patient presents with a wound that is dirty, deep, and contaminated. The CEN should: Option A. Irrigate and debride the wound. Option B. Close the wound primarily. Option C. Leave the wound open. Option D. Apply a pressure dressing. The correct answer is option A. Irrigate and debride the wound. Dirty wounds require extensive irrigation with normal saline to remove debris and bacteria. Debridement of devitalized tissue is essential to prevent infection. Primary closure may be delayed primary closure, to allow for drainage and monitoring. Pressure dressings are not the primary treatment. Tetanus prophylaxis is indicated. Question 13. A patient presents with a panic attack, shortness of breath, chest tightness, and paresthesia. The CEN should: Option A. Apply a paper bag to rebreathe CO2. Option B. Provide reassurance and instruct the patient to take slow breaths. Option C. Administer a benzodiazepine. Option D. Perform an ECG. The correct answer is option D. Perform an ECG. Chest pain and shortness of breath in any patient should be evaluated for medical causes, ACS, PE. An ECG, vital signs, and appropriate labs should be done. While panic attacks are a common cause of hyperventilation, the CEN should not assume this without ruling out life-threatening conditions. If organic causes are ruled out, reassurance and breathing exercises are helpful. Question 14. A patient with a suspected myocardial infarction has a cardiac arrest. The ECG shows ventricular fibrillation. After the first defibrillation attempt, what is the next step? Option A. Resume CPR immediately for 2 minutes. Option B. Administer epinephrine 1 mg for. Option C. Administer amiodarone 300 mg for. Option D. Check a pulse. The correct answer is option A. Resume CPR immediately for 2 minutes. After defibrillation for VF/pulseless VT, the ACLS algorithm directs an immediate return to CPR for 2 minutes, 5 cycles, before checking the rhythm and pulse. Epinephrine is given after the second shock. Amiodarone is given after the third shock. High-quality CPR is essential for outcomes. Question 15. A patient with acute pelvic pain, vaginal bleeding, and hypotension has a positive pregnancy test. Which intervention is the priority? Option A. Transvaginal ultrasound. Option B. 4 fluids and cross-match blood. Option C. Beta HCG level. Option D. Surgical consultation. The correct answer is option B. 4 fluids and cross-match blood. This patient is hemodynamically unstable, hypotension, positive pregnancy test, vaginal bleeding. The priority is stabilization with 4 fluids and preparation for blood products, as a ruptured ectopic pregnancy is likely. While ultrasound and surgical consultation are important, volume resuscitation is the immediate priority to prevent hemorrhagic shock. Question 16. A patient with status epilepticus has received lorazepam 4 mg for without cessation of seizure activity. The CEN should anticipate which next medication? Option A. Phenytoin 20 mg/kg4. Option B. Propofol 20 mg/kg4. Option C. Valproic acid 20 mg/kg4. Option D. Levetiracetam, Keppra, 1 g/4. The correct answer is option A. Phenytoin 20 mg/kg4. After benzodiazepines, lorazepam, second-line agents include phenytoin, 20 mg/kg4, or fosphenytoin. Levetiracetam and valproic acid are also options but may be considered after phenytoin. Propofol is used for refractory status epilepticus. Airway management is critical, the patient may require intubation. Question 17. A patient with suspected C. difficile infection should be placed on which type of precautions? Option A. Contact precautions. Option B. Droplet precautions. Option C. Airborne precautions. Option D. Standard precautions. The correct answer is option A. Contact precautions. C. difficile is transmitted via the fecal-oral route, contact with contaminated surfaces or feces. Patients should be placed on contact precautions, gloves and gowns, with hand hygiene using soap and water. Alcohol-based hand rub is not effective against C. diff spores. Private room is preferred. Droplet and airborne precautions are for respiratory infections. Question 18. A patient with anaphylaxis presents with stridor, hypotension, and respiratory distress. The CEN should: Option A. Administer epinephrine IM. Option B. Administer epinephrine 4. Option C. Administer albuterol nebulizer. Option D. Administer diphenhydramine 4. The correct answer is option B. Administer epinephrine 4. IM epinephrine is first line for anaphylaxis, but in severe cases with hypotension and stridor, airway compromise, 4-epinephrine may be needed. 4-epinephrine is a more potent vasoconstrictor and inotrope, reserved for severe presentations. Albuterol and diphenhydramine are adjuncts, not primary. Question 19. A patient presents with severe eye pain, headache, nausea, vomiting, and a cloudy cornea. Which diagnosis is most likely? Option A. Central retinal artery occlusion. Option B. Acute angle closure glaucoma. Option C. Retinal detachment. Option D. Corneal abrasion. The correct answer is option B. Acute angle closure glaucoma. Acute angle closure glaucoma presents with severe eye pain, headache, nausea, vomiting, a red eye, a cloudy cornea, and a fixed, mid-dilated pupil. It is an emergency requiring immediate reduction of IOP with topical beta blockers, alpha agonists, carbonic anhydrase inhibitors, and hyperosmotic agents. Miotic agents, pilocarpine, are used after the acute attack is controlled. Question 20. A patient with a tracheostomy tube dislodges it. The CEN should: Option A. Call respiratory therapy. Option B. Reinsert the tracheostomy tube immediately. Option C. Cover the stoma and ventilate via bag mask over the mouth and nose. Option D. Suction the stoma and reinsert a smaller tube. The correct answer is option C. Cover the stoma and ventilate via bag mask over the mouth and nose. If a tracheostomy tube dislodges, the CEN should cover the stoma with a gloved hand and attempt to ventilate via bag mask over the mouth and nose. If ventilation is not effective, the stoma may be used for ventilation, with a smaller tube or tracheostomy obturator. Reinsertion should be attempted by trained staff. Blind attempts can create a false passage. Suction and airway support are priorities. Question 21. A patient's ECG shows a heart rate of 40 bpm with wide QRS complexes and no association between P waves and QRS complexes. This rhythm is: Option A. Sinus bradycardia. Option B. Atrial fibrillation. Option C. Third-degree AV block. Option D. Ventricular escape rhythm. The correct answer is option C. Third-degree AV block. Third-degree, complete, AV block is characterized by complete dissociation between atrial and ventricular activity. The atrial rate is usually faster, P waves, than the ventricular rate, wide QRS escape rhythm. This is unstable and may require transcutaneous pacing or atropine, though atropine is less effective for infranodal blocks. Question 22. A patient has anaphylactic shock. The CEN should administer which medication first? Option A. Diphenhydramine 50 mg 4. Option B. Methylprednisolone 125 mg 4. Option C epinephrine 0.3 to 0.5 mg IM, 1:1000. Option D albuterol nebulizer. The correct answer is option C. Epinephrine 0.3 to 0.5 mg IM, 1:1000. Epinephrine is the first-line treatment for anaphylaxis. It causes vasoconstriction, bronchodilation, and decreased mediator release. The dose is 0.3 to 0.5 mg IM, 1:1000 concentration, in the anterolateral thigh. Antihistamines, steroids, and albuterol are adjunctive treatments and should not delay epinephrine administration. Question 23. A patient with acute cholecystitis presents with right upper quadrant pain, nausea, vomiting, and fever. Murphy's sign is positive. Which diagnostic test is preferred? Option A abdominal ultrasound. Option B CT scan. Option C HITA scan. Option D X-ray. The correct answer is option A. Abdominal ultrasound. Ultrasound is the diagnostic test of choice for acute cholecystitis, showing gallstones, gallbladder wall thickening, and pericholecystic fluid. Murphy's sign, pain on deep inspiration while palpating the right upper quadrant, is a classic finding. Treatment involves NPO status, 4 fluids, antibiotics, broad spectrum, and cholecystectomy. CT may be used if complications are suspected. Question 24. A patient presents with sudden onset of severe, sharp, lower abdominal pain radiating to the flank, nausea, and hematuria. Which diagnosis is most likely? Option A appendicitis. Option B renal calculi. Option C ovarian torsion. Option D diverticulitis. The correct answer is option B. Renal calculi. Renal calculi, kidney stones, present with sudden, severe flank pain, renal colic, radiating to the groin, nausea, vomiting, and hematuria. CT scan without contrast is the diagnostic test of choice. Pain control, 4 opioids or NSAIDs, and fluids are the mainstays of treatment. Ovarian torsion presents with adnexal pain and should be considered in female patients. Question 25. Which ECG finding is most concerning for a patient with a heart rate of 220 beats per minute and a blood pressure of 80/50 mmHg? Option A atrial fibrillation with rapid ventricular response. Option B supraventricular tachycardia, SVT. Option C ventricular tachycardia with a pulse. Option D atrial flutter with 2:1 block. The correct answer is option C. Ventricular tachycardia with a pulse. Ventricular tachycardia with a pulse and signs of instability, hypotension, heart rate 200, requires immediate synchronized cardioversion. Unstable patients with tachyarrhythmias should be cardioverted promptly. Waiting for pharmacologic therapy in an unstable patient can be fatal. The other rhythms may also require treatment but are less immediately life-threatening in this scenario.